world's population is aging rapidly and has assumed a lifestyle that predisposes the body to the so-called civilizational diseases. These trends bring about a multitude of healthcare challenges. Heart disease remains the #1 cause of mortality in America. At 60%, coronary artery disease is the largest component of heart disease, and at least 20 million Americans over the age of 20 live with the consequences of this condition. Chronic stable angina is the symptomatic expression of coronary artery disease, typically manifesting as chest pain and shortness of breath. More than 11 million Americans suffer from this condition, and its prevalence keeps rising. Innovations in the treatment of coronary disease over the past decades have been impressive. Especially, improvements in revascularization may have led to expectations that angina symptoms may eventually disappear. But we should know better by now. Elective revascularization in chronic stable angina patients does not appear to eradicate angina symptoms any better than optimized drug treatment alone. Yet, it puts a heavy financial burden on the patient and the entire healthcare system. Revascularization continues to leave many patients with symptoms of angina. So optimized pharmacotherapy appears to be here to stay for many stable angina patients. How is it then that the medications we are using to treat the symptoms of chronic stable angina are decades old, and that the last medication approved in the US was back in 2006? That is more than 15 years ago. Given the lack of development of antianginals in over 15 years and the rising numbers of angina patients, the question is, how good is the current antianginal medication portfolio in the US? Do the available medications address symptoms effectively? And can they impact the underlying coronary disease trajectory in any meaningful way? Nearly a quarter of all US angina patients suffer daily or weekly symptoms. Over half of these patients continue to experience angina episodes despite taking 2 or more medications. Some patients need as many as 3 or more medications to control their symptoms. Clearly, there's need and room for improvement. And none of the medications we have demonstrated a reduction in risk of the underlying disorder in chronic angina patients.
So, do we need new medications for better symptom control in chronic stable angina? Medications that not only effectively address symptoms, but also reduce long-term cardiovascular risk? Do we need medications that affect not only macrovascular, but also microvascular aspects of chronic angina? Medications that may reduce chronic angina-related costs like hospitalizations? Well, at Auxilius Pharma, we believe we do, and we are working on solutions.